right, good afternoon, fellow Seattle scientists, nurses, physicians, healthcare workers, researchers, and allies of the scientific community. My name is Justin Gill, and I serve as the president of the Washington State Nurses Association, which is an organization that has over 20,000 nurses and members and focuses on the interests of over 100,000 nurses in the state of Washington. I have to say, as a clinician, it's inspiring to see so many of you here today because it gives me hope that our community can leverage our collective strength to push back on the anti-science trend that threatens our loved ones, our neighbors, and our communities. I'm honored to stand before you today as we come to defend the very foundation of healthcare, which is science, truth, and the people who dedicate their lives to keeping our communities healthy. We as nurses are as part of this movement because attacks on science and healthcare workers affects patient care. It affects the care that we deliver every single day. Nurses have been consistently ranked the most trusted profession in the United States for 2 decades based on Gallup polling. And with that trust comes a responsibility to speak truth to power and boldly stand up for what is right for patients and healthcare delivery. Yes. We as nurses have always been here through the pandemics, natural disasters, public health crises. We show up, we serve, and we protect our patients with the best science and evidence-based recommendations. Yes. Yet, despite our work praised during the COVID-19 pandemic, today we find ourselves dismissed, ignored, and under attack by those who would rather push an anti-science agenda rather than protect the health of the public. Yes! In this moment, my nursing and healthcare colleagues are done only receiving temporary convenient designations as healthcare heroes for a short while, and then have our voices and suggestions for improvement dismissed. Yes! Yes! We demand action alongside all of you, that we are recognized for our experience through action, not words alone. I'm going to be clear that we stand by as the credibility of our healthcare institutions is undermined, as science is twisted for political gain, and our ability to care for patients is compromised. Nurses do not back down. We stand up, we speak up, and today we push back. Yay! So why is science important in healthcare and why it matters? Well, science is the foundation of healthcare. Without it, we wouldn't have vaccines, antibiotics, cancer treatments, life-saving surgeries. But today we're seeing a disturbing trend, an attack on scientific truth that's threatening the stability of our healthcare system and the well-being of our patients. Now beliefs in previously near consensus ideas, such as the importance of routine vaccines and public health measures to protect our most vulnerable patients, have been subject to political innuendo and opinion. Diseases we once thought were eradicated, like measles and pertussis, are making a comeback. Why? Because misinformation is spreading faster than the truth, and it's being coupled by political incompetence. Yeah! And now, with the news of a second measles death, this time in an adult patient in New Mexico, the rise of bird flu and the worst flu season that I've seen in my clinical practice in over a decade, we simply cannot afford to have science ignored and healthcare workers dismissed. Yes! In the face of all of this, we've seen recent meetings of the Advisory Committee on Immunization Practices canceled or delayed. We've seen actions and policy decisions decelerate our ability to confront flu and infectious diseases. And for people like myself that have to confront these illnesses head on, this is not just disheartening, it's insulting. And it does nothing to support the work that we do. In fact, it works directly against our mission as nurses and healthcare workers. Yes. This also has a direct impact on the burnout of nurses and healthcare workers, because when the systems at the highest level fail to maintain trust and combat misinformation, we struggle to try and provide the best care for our patients who may be misguided or misled. And it adds to further strain and frustration to us and the work that we provide when we see leaders that fail to put the necessary resources into the systems and institutions that we rely on to stay safe and healthy.
Yes.
So there are right now many changes in the way that this country is investing in healthcare and research institutions. Instead of strengthening them, they're being dismantled. Funding cuts to the very research that drives medical advancements, such as a 15% cut to the NIH, is not just a number. It's a direct hit to the pipeline of new therapies, treatments, and that our patients rely on. It's a blow to cancer research, Alzheimer's treatments, and breakthroughs that could save millions of lives. And it's not just research. We're seeing dangerous cuts to the very agencies responsible for tracking and responding to infectious diseases. Why would anybody think that right now is the time to cut CDC employees and that investigate outbreaks? Who thinks that's a good idea? It's not just irresponsible, it is dangerous. Without sufficient public health surveillance, we risk the ability to predict and prevent major outbreaks. Without funding for new drug research, we fall behind the race against antibiotic-resistant bacteria and emerging diseases. Without investing in our healthcare infrastructures, our hospitals and clinics will be overwhelmed the next time a crisis hits. Nurses, physicians, and frontline workers were battered by this last pandemic, and we work in extremely challenging environments. The last thing that we need to do for our jobs is have chaos and a breakdown of our systems at the top. The threat that I'm mostly, or at least immediately concerned about, is one that will cost us dearly, and it's the censorship of science and attacks on diversity and equity in our healthcare system. When public health institutions like the CDC, the FDA, and the NIH are forced to alter or scrub information, our ability to provide accurate, life-saving care is compromised. When I see a patient, they come to me expecting the best evidence-based recommendations, but when the data we rely on is censored, distorted, it puts lives at risk. When patients are perceived and utilized in a way that, or when facts are perceived and utilized in a way that manipulates the truth, trust in the work that we do is minimized. I've personally seen patients suffer because they were misled by false cures and conspiracy theories by those who claim that science may be the enemy. During the COVID-19 pandemic, I cared for patients who refused life-saving treatment because they were told lies. Some of them did not make it. I distinctly remember these experiences. I remember the mom who did not get vaccinated because of hearing lies and misinformation from politically motivated figures who questioned the science behind vaccines and treatments. I remember barely being able to keep her oxygen levels stable in the clinic while we waited for an ambulance that wouldn't get there for another 15 to 30 minutes. I remember the husband who had fear in his eyes as we were waiting for that ambulance. Unfortunately, these situations continued, but with more mothers, more fathers, grandparents, siblings, and other loved ones, we tried our best to help, but our interventions were limited because the damage had already been done. This is a reminder that when people push misinformation or discount the hard work and rigor that goes into scientific inquiry, the consequences can be dire.
Yes.
These experiences, like for many of my colleagues, are experiences that I will never forget. They sit permanently in our minds as a reminder of how important words and guidance matters in our healthcare system. And let's be clear about another item here. It's attacks on diversity and inclusion in healthcare is an attack on patient care. Look, nurses serve patients from every background, every community, every walk of life. When we advocate for diversity in our workforce, it's because we know firsthand that the patients we see in clinic, in our hospitals, they receive better care when they see providers who understand their lived experiences. Cutting these initiatives does not just hurt nurses, it hurts the very patients we serve. And it's proof that healthcare is not a political game. It's a human right. And it's our duty to ensure that our institutions remain strong, that our scientific research remains free from political interference, and that our workforce reflects and serves the communities that we see and the communities that we serve. And let's also be clear that the ability to access the healthcare system is just as important as the care delivery and the treatments we provide. If we gut essential programs like Medicaid that serve as a lifeline for so many of our patients, we're going to see lives lost, and we'll see a direct and indirect impact on the healthcare system for each and every one of us. So this is my call to action here. We cannot wait for the next pandemic or outbreak or healthcare crisis to act. The time to act is now. We cannot wait for our current federal leadership to make potentially deadly decisions and react. We need to be proactive and hold the line on issues that matter most to us. We need to draw that line in the sand on these issues with our expertise and our voices. So what do we demand? We demand full funding for the NIH, the CDC, and all research institutions. We demand it. We must push back against misinformation and the anti-science rhetoric that leads to preventable disease and death. We must insist that our healthcare workforce remains diverse, representative, and empowered to serve all of us. We must not be silent. We must show up. We must make our voices heard in hospitals, legislatures, communities, and at the ballot box. Yes, we're frustrated, but more than that, we're motivated. We're not going to be distracted, we're not going to be deterred, we're going to be persistent, and we're going to be vocal. So let me ask all of you, are we going to let misinformation dictate the future of healthcare? No! Are we going to stay silent when science is under attack? No! Are we going to sit back as our healthcare institutions are dismantled? No, we are going to speak up and we are going to stand up. We're going to stand up for science. We're going to stand up for truth. We're going to stand up for our patients, community, and the future of healthcare. And I have a message for those that may seek to sow distrust in our health and research institutions, so listen closely to them. You have picked the wrong group of healthcare professionals to dismiss and discount. We are the ones that fought on the front lines of a global pandemic against unprecedented challenges. We're the ones in the ERs, ICUs, and clinics and hospitals in the country, and it's pretty obvious that we do not back down and we do not yield to misinformation and lies. There's a difference between those of us who actually care for patients on the front line and those that promote bad policy and false information for political gain. Unlike the latter group, we as healthcare professionals are accountable for the advice and care we provide for our patients. Political figures that put personal political gain before what is right are not. When they put out lies and misinformation, providers like myself and the patients and families that I treat have to deal with the consequences. We're the ones who pick up the pieces of political censorship and interference in our healthcare systems, and we will be the first ones to stand up and call for an end to it. So, in closing, just like we do as nurses in hospitals, clinics, public health departments, nurses will join you all and advocate, because when the stakes are high, we do not sit down, we stand up. When we stand together, when we speak up together, when we push back together, we will make a difference and we will save lives. Thank you to everybody that showed up today, and let's keep moving forward. Thank you.